Hello guys, मेरा नाम है सुब्रत एंड आई एम सेकेंड ईयर एमबीबीएस स्टूडेंट एट जीएमसी सुंदरगढ़। तो आज हम शुरू करेंगे एक नया सीरीज जिसमें कि हम फर्स्ट ईयर के जितने भी सारे हिस्टोलॉजी के स्लाइड्स होते हैं उन सबको डिटेल में यहाँ पे पढ़ेंगे। तो आज का जो हमारा पहला वीडियो होगा इट्स गोइंग टू बी ऑन लिवर। लिवर के हिस्टोलॉजी के स्लाइड्स को अच्छे से समझने के लिए हमें उसके कुछ बेसिक फीचर्स जानने पड़ेंगे, जिसमें आता है कैप्सूल एंड कनेक्टिव टिश्यू ऑफ द लिवर। Liver is covered with Gleason's capsule. This is the Gleason's capsule and the connective tissue. Here you can see this is the classical lobule of the liver, the classical hexagonal lobule. This is the central vein. In this white part, this is the connective tissue part, which is made up of type 3 collagen. Next is the parenchyma or the hepatocytes. The hepatocytes are large polygonal cells. Their nuclei show huge euchromatin and 1 to 2 nuclei. You can see these are the hepatocytes. These are the hepatocytes, and this is the nucleus. And inside the nucleus, you can see there is presence of more than one nuclei. The hepatocytes may be binucleated, having 4N DNA. There is presence of regeneration capacity in the hepatocytes. Next is surfaces. The hepatocyte consists of three types of surface. One is the sinusoidal surface, another is canalicular surface, and intercellular surface. Now this is a hepatocyte, and this is the sinusoid, the hepatic sinusoid. The surface that is present towards the hepatic sinusoids, that surface is called as sinusoidal surface. And you can appreciate this is the biliary canaliculi. And the surface of the liver that is present towards the biliary canaliculi is known as the canalicular surface. And in this image, you can see this surface which doesn't contain any biliary canaliculi. There is no biliary canaliculi, and there is the presence of tight junctions which adjoins two neighboring cells. That surface is known as intercellular surface. Okay. Now, as you know, the blood supply of the liver, it receives blood from hepatic artery and portal vein. That ultimately goes to the liver sinusoids, means to this area, this liver sinusoidal area, and that drains into the central veins, to the sublobular veins, to the hepatic veins, and at the end to the inferior vena cava. That goes to the right atrium of the heart and to the right ventricle. Now let's see some important structures of the liver. One is the classical lobule, another is portal lobule, the last one is liver vessels. So what is classical lobule? If we take central vein as the center and at the six corners there are presence of portal triads. You can see at the corner there is presence of portal triad. Then the structure we get, that is classical lobule. At the center there is central vein, and at the corners there is presence of portal triad. That structure is called as classical lobule. And the portal lobule. In the classical lobule, we were taking central vein as the center. In the portal lobule, we are taking portal triad as the center and connecting the central vein of the three classical lobules. The last one is liver vessels. When we take four classical lobules and join the central vein to the portal triad, the portal triad to the central vein to the portal triad to the central vein. Then the structure we get is the liver vessels. And there are two axes. One is the short axis, one is the long axis. Now the short axis, this is the short axis. It divides the liver vessels into two parts. What is the long axis? If we join The two central veins are the adjoining two classical lobules, then we get the long axis. The short axis that divides the liver acinus into two parts. So each part of liver acinus contains three zones, zone 1, zone 2 and zone 3. So can you say this is the portal triad? And in portal triad, there is presence of three things. One is the hepatic artery, one is the portal vein, another is the bile duct. Hepatic artery, portal vein, and bile duct. So if there is the presence of the hepatic artery, so zone 1 will accept maximum amount of oxygenated blood because hepatic artery contains oxygenated blood and central vein contains deoxygenated blood. So zone 1 will get maximum amount of oxygenated blood. Then zone 2 will get less amount of oxygenated blood. And the zone 3 will get least amount of oxygenated blood. So can you say which zone is more prone to hypoxia? Yes, this is the zone. Yes, there is three zones, zone 1, zone 2, zone 3. This is the periportal zone, more exposed to digestive nutrients and has high oxygen supply. Zone 2, it is intermediate region, and zone 3, central zone, has poor oxygen supply and more prone to hypoxic injuries. Now in this image you can see this is the classical lobule of the liver. This is the central vein at the center, and this is the portal triad. This is the portal triad. And these are the codes of hepatocytes. And this is a code of hepatocyte, and this is a code of hepatocyte. This term, this white part is the liver acinus. So you can see this is the portal triad, this is the hepatic artery, this is the portal vein, and this is the bile duct. Okay. Now two important things: liver sinusoid and space of the liver sinusoid, it is lined by discontinuous endothelium and there is presence of liver macrophages that are known as buffer cells. So liver sinusoids, this is liver sinusoid. There is presence of discontinuous endothelium. These are the discontinuous endothelium and the liver macrophages that are known as buffer cells. Here you can see this is the liver macrophage, or that is known as buffer cell. Okay. Now the space of descent. The space between the sinusoidal endothelium and hepatocytes. The space between the discontinuous endothelium, this is the discontinuous endothelium, and the sinusoidal lining of the hepatocytes. Now the space of Dusay, it is the site of hematopoiesis in fetal life, and there is presence of itocells or stellate cells. So itocells that store vitamin A and liquid, and stellate cells that cause synthesis of the collagen 1 and 3 that is responsible for liver cirrhosis because in liver cirrhosis there is fibrosis of the liver and that is due to the collagen 1 and 3 that is synthesized by stellate cells. You can see this is the stellate cell or itocyte. Okay. Now let's see the portal triad. This is the slide of the liver cirrhosis. So this is the portal vein. Okay. Can see the size of the portal vein is very large as compared to the bile duct and the hepatic artery. Because in liver cirrhosis, there is portal hypertension that leads to the enlargement of the size of the portal vein. In this magnified image, you can see this is the portal vein and this is the bile duct and this is the hepatic artery. Bile duct get generally lined by cuboidal epithelium or maybe lined by columnar epithelium. The small bile ducts that are lined by cuboidal epithelium and the large bile ducts that are lined by columnar epithelium. So now let's see the histology slide of the liver. First, how do we identify that this is the liver slide? First, we have to see the classical hexagonal lobule of the liver having central vein at the center and portal triad at corner. In this way, we can identify that this is the liver side and heavy cohorts of hepatocytes. So this much for today's video. Thank you.